we have the other problem. Most of them are barefoot, and most of them live on the ground floor of ill-ventilated areas. So, what we do is visit them and treat them symptomatically. This is not a treatment in true sense, because you cannot treat somebody prescribing only once in a week. And the other problem we have there at the Bhutiari is the implementation of the advice given by the doctor. As I have already mentioned, our organization is not a strong one economically. So there are gaps, there are lapses between, say, the prescription and the implementation of the prescription. There are many pitfalls. And I am not surprised if the mother gives the child's medicine to the father and the father's medicine to the child. Because of illiteracy, because of poverty, and because of lack of recreational facilities, another picture that has come to my mind there is the overpopulation. If there are, say, 10 ladies in the queue, you can be sure of one thing, there will be at least 30 patients. One in her lap, the other holding her hand, and the one another behind her, and so on. So, the situation worsens with a longer day. Sometimes they come without the children, there being, say, 3 children, and then request for another prescription for the 4th one, who is not in front of me. 2 years ago, there used to be, say, about 100 patients, even 100 patients. Imagine a situation that we have to see 100 patients between, say, 3 o'clock and, say, 5 o'clock. In true sense, I didn't have time even to have a look at the face of the child or the lady. So, before they start telling me what is their main complaint, I have completed writing my prescription. And I must confess, this is not a real treatment. This is not an ethical treatment. But I also know, and this is how I console myself, what we give them is something more than blessing to them. Because they cannot go to a chemist shop and buy medicine. They cannot go and see a doctor. And when we say doctor, I also mean the local quacks. As a member of the profession, it is not ethical. I am not saying the quacks are good. But we have to admit the fact that the real Bengal healthcare is in the hands of the staff. You may or may not have the nursing staff. You have the doctor who probably doesn't stay there and maybe visits once a week or twice a week. This is the picture in most of the primary and secondary health centers. So, drop to Kolkata solution probably is something in between these two. I console by thinking that probably I am working in a rural health center without its own building. We actually sit in an area which is less than half of this. And that is where we don't have...
Running short of time, but so we thought that we should be having lunch break now, but again we thought, okay, let us postpone it. Anything? Oh, we would be having lunch after another half an hour. Would it be inconvenient for you? I don't think it would be okay. So, I was supposed to speak much earlier on certain topics, but as rescheduling has taken place, so I'm thinking I will be speaking a little bit now, and after lunch of some other topics, okay, later. So, I will be talking on something like this, the access to healthcare in West Bengal and rest of India and rest of the world. In fact, what I felt that due to lack of purchasing power, lack of proper administration, lack of monitoring and lack of other things, we don't have adequate access of healthcare facilities, even if sometimes you find that infrastructure is there, some kind of infrastructure is there, that is, you have the health centers, hospitals and other things. but they are not equitably distributed. That's the most unfortunate thing in the irony. You see, particularly you find WHO report. If you look into the WHO report, you find that they have listed, 240 essential medicines, okay? 240 essential medicines which are supposed to be essential for the common people, for the common purpose, common disease and all that. But unfortunately, we find sometimes in the health centers in the rural areas, in the villages, in the sub-health centers or in city hospitals also, you find costly medicines, availability of costly medicines, but paradoxically, you don't have the supply of very essential medicines. So these 240 medicines, you see, now some kind of computerized system has been implemented in Tamil Nadu particularly, through which they have ensured the availability of these 240 medicines any time to any people. But in other states of India, you find still it is not implemented. Sometimes you find that a very rustic person, a very poor person, I won't say poor that way, but unprivileged person in the rural area, there is a sub-center, health center, there is a doctor also, but he is not getting the medicine and the availability of other equipments, etc. So I will be giving some published by NSS, National Sample Survey, then WHO also, and other places, other agencies, through which you get some evidences how this is working. In 1993, we had in our place in India about one health center or one hospital. But in 2001, we have for each 30,000 people, we have one health center. But quite often you would find these health centers are there, sometimes doctors are there, sometimes nurses are there, but you won't get the medicines or the other very useful things which should be provided to the patients. So what happens?